The arc of the moral universe is long, but it bends toward justice. Dr. Martin Luther King Jr. Welcome to Burden of History, where we uncover stories that demand to be told. Today marks the beginning of our new series, Medical Racism in America. And there's no better or more devastating place to start than the Tuskegee Syphilis Study. This story begins in 1932 when the U.S. Public Health Service launched a government-funded study in Tuskegee, Alabama. The goal? To observe the long-term effects of untreated syphilis in Black men. But what actually happened was nothing short of a national disgrace. Over 600 African American men were recruited, most of them poor sharecroppers. They were told they had bad blood, a vague term used to describe everything from anemia to fatigue. The men were promised free health care, meals, and even burial insurance, but they were never told they had syphilis. And most tragically, they were never told they would not be treated for it. Even after penicillin became the standard treatment for syphilis in 1947, the doctors and officials involved in the study made the conscious decision not to give it to them. They wanted to see what would happen when the disease ran its full course. Let that sink in. Treatment existed, but it was withheld deliberately. Out of the original group, 399 men had syphilis, and they were left to suffer, some in silence, some unknowingly, as the disease ravaged their bodies. Many of these men passed away, some went blind, others insane. Wives were infected. Children were born with congenital syphilis. And the government kept this going, not for 1 year, not for 5, but for 40 years. The study finally came to light in 1972 when a whistleblower, Peter Buxton, leaked the details to the press. Only then was the program shut down. The public outcry was immediate and overwhelming. In 1973, a class action lawsuit was filed. And in 1997, 65 years after the study began, President Bill Clinton issued a formal apology on behalf of the U.S. government, saying, "What was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry." But the damage was done. Generations of Black Americans were left with a deep, understandable distrust in the healthcare system, a legacy that still echoes today. Author's note: this story isn't just a painful chapter in our history. It's a mirror, a reminder of what happens when science forgets ethics and when racism infects even the most trusted institutions. Remember these men. Say their names. Refuse to let history repeat itself. The lawsuit and settlement. After the Tuskegee Syphilis Study was finally exposed in 1972, a class action lawsuit was filed in 1973 on behalf of the victims and their families. The U.S. government agreed to a $10 million settlement, a small sum for decades of suffering and betrayal. Each surviving participant received about $37,500, while heirs of deceased men were given around $15,000. The government also provided lifetime medical and burial benefits to those still alive. Later, some benefits were extended to spouses and children through the Tuskegee Health Benefit Program. But no one went to prison. No doctor lost their license, and no government official was held personally accountable. The pain passed down. For the families left behind, money could never undo what was lost. Wives infected, children born with syphilis, generations traumatized by lies told in white coats. The legacy of Tuskegee is not just what happened to 399 men, it's what happened to their entire bloodlines. And it's why many Black Americans today still carry deep distrust toward the medical system. That trust wasn't just broken, it was betrayed. Closing call to action. Thank you for watching Burden of History. If this story moved you, please take a moment to like, comment, and share. And subscribe for the next chapter in our medical racism series. Because justice begins with truth, and truth demands to be heard.